Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today we're talking about the concerns of joint replacement surgery. Can you talk about the difference between anterior versus posterior procedures for hip replacement and why one might be better than the other?
The three main deciding factors for, I think, most people are the surgeon's familiarity with the approach and the way they're used to doing it, degree of arthritis people have and the complexity of that, and the patient's body shape.
Is there a way to prepare for hip replacement surgery?
It's good to keep moving, keep walking, strengthening the muscles around your hip and even your heart by doing cardiovascular exercise.
What actually happens during the procedure?
Basically, the ball is removed from the end of the femur and a new socket is placed, which is titanium and a very special plastic, and then a new ball is placed on top of a stem that goes actually inside the bone. Basically, that replaces the worn out ball and socket.
Will I need another replacement if I get it when I'm young?
These implants that we have today, probably 95% of them are still functioning well at 20 years, but if you have a replacement when you're young, you may need to have it replaced again in the future, and you can have it done more than once.